What we're going to discuss during this segment is characterizing the severity of C. difficile infection, and there are two main factors to consider when we consider the severity. One being healthcare-associated infection versus community-associated, and the second are the serologic values, specifically the white blood cell count, the creatinine, and the albumin. This is a slide from the Lessa et al. Study that we covered in the epidemiology section. Specifically, within this study, they categorized patients as either having community-associated infection, defined by the onset of symptoms in the community or within 72 hours of admission to the hospital without being hospitalized within the previous 12 weeks, compared with healthcare-associated infection, everybody else. Those with healthcare-associated infection had a statistically significantly higher mortality rate, 9.3%, versus the 1.3% in community-associated infection. So any individual who has healthcare-associated infection has a more severe form of the infection. The other factors to consider are the serologic values. And this slide shows categorizations made within the American Journal of Gastroenterology guidelines published in 2013. Specifically, they characterized a severe infection based upon patients having an albumin less than 3 with either a white cell count greater than 15,000 or abdominal tenderness. They characterized severe complicated infection as any patient that has end organ damage, a fever with a temperature greater than 38.5 Celsius, any individual who was septic, any individual who required the intensive care unit, had a lactate greater than 2.2. All were factors. Independently, though, the Infectious Disease Society of America, in their update to the guidelines, stated that severe infection should be defined by a white blood cell count greater than 15,000 or a creatinine greater than 1.5 milligrams per deciliter. What I say is that we should use all three. If patients have a white cell count greater than 15,000, a creatinine greater than 1.5 milligrams per deciliter, or an albumin less than 3, they have severe infection. Within these IDSA guidelines, in addition, classified severe complicated disease, or recalled it fulminant disease, as those patients that have hypotension, shock, ileus, or megacolon. By characterizing whether patients have community versus healthcare-associated infection and using their serologic values to predict severity, we as practitioners are able to triage who requires more aggressive therapy and therefore potentially improve outcomes.